Hi, class. Welcome to Chapter 4 of Intro to Psych. Today we're going to be talking about consciousness. So, if you think about what we've covered so far in these series of lectures, we've gotten to the point where we know what the brain is and how the brain takes in information. It brings in information with the senses and it perceives things, and then we do things. But what is going on up here? What does it mean to be conscious? And that's something we're going to kind of talk about in this lecture. Now, when it comes to what is consciousness, well, it's kind of a tough thing to describe. We all know what it means to be conscious. If you're listening to this and paying attention, you're conscious. But it's hard to describe. So, to describe it, we use two different factors. We use this factor of awareness, being aware of ourself, of our thoughts, of what's going on in our own experience, as well as arousal. And this is not sexual arousal, this is physiological arousal. It's the fact that we are not just sleeping, right? We are doing things with the environment. Even if it's just sitting there, we're taking in information. And we all know the idea of being conscious. We have a sense of waking consciousness, this idea of just being alert, knowing what is going on, having our clear thought sensations, and maybe some of us have experienced altered states of consciousness, whether that be through being very tired or being sick or using drugs. Things like this can alter our states of consciousness. Also, things like meditation and hypnosis that we'll talk about. But when we think about consciousness, I like to bring up this word qualia or qualia. And this is a Latin phrase that comes from, or that basically translate to like of the quality. So, or of what kind. So it's the fact that when you think of things, right, when you have a perception of your headache, when you have a headache, you have that feeling, that qualia, that feeling of this. You know what your morning coffee tastes like, that taste, that consciousness, or how orange you perceive the sky, or what color you perceive this dress as. This idea of qualia is subjective. I can't get in your head and tell if you see the same color blue that I do. However, right, this is something that psychology is looking at. One thing I like to note is that, right, when we try to break down what consciousness is, there's a couple words that sound like consciousness and we might think mean the same thing but are a little different. And so when it comes to being a human, I would say that we are not only conscious, we are alert and aware, but we also can feel, we can perceive the world, and we are able to manipulate the world, from lack of better things, use our knowledge, build a tool to help us in the world. And these are all going to be parts of maybe this idea of consciousness. But again, right, thinking about why maybe a robot isn't conscious, but is an ant, it's a question you can argue. When does consciousness start? This is a question, right, we don't necessarily know. Many of us have an experience of being very young and all of a sudden realizing like, oh, I'm here. Your first kind of memory. Well, it's hard to claim because can babies experience consciousness? Well, they can't tell us. So this is going to be something hard to look at. One thing we can look at, kind of a good outside resource is this video, Kurzgesagt, I can't pronounce that correctly, that kind of goes over a lot of what we talk about and maybe ties this together if you're interested. But if you think about like what we've been talking about, this idea of this hard problem of consciousness, this idea that philosophers for millennia have been trying to figure out. How is it that we can perceive the outside world or sense the outside world, perceive it by this firing of neurons, and make it conscious perception in our brains? This is a very difficult thing. Well, we're not there yet, but every day neuroscience and psychology get us a step closer. And when we think about this, it's really a philosophical perspective, one that you might ask yourself. So when it comes to consciousness, you can ask yourself, are the mind and the brain, or even the mind and the body, the same thing? Is your mind different than your brain? And from a philosophical perspective, all the way back since Rene Descartes, he promoted this idea of dualism. Dual, two different things, that our consciousness, our mind, is not our body, that these are two separate things. Now, that's not what everybody thinks. There is a refutation from this, from Hobbes. Hobbes believed in materialism. This material brain creates the mind. It's the firing of the neurons in the brain, which he didn't know at the time, but right, he's going to make that argument. Fun fact, he also hated Rene Descartes, but that's beside the point. So this idea of dualism, this belief that the mind and body are separate, is one way we can think about the world. Many people perceive this as the body, right, or the human, kind of the human experience having a soul, right? And so that soul being different than the mind, or excuse me, than the body. The problem with that is we can't test that with any way of falsifiability. We can't really, quote unquote, prove that there is something there. It's unverifiable. So what we end up doing is taking a materialistic perspective. Now, that doesn't mean psychologists are materialistic. We want to buy a lot of items, but this means that we take a perspective that the mind is nothing more than the firing of neurons. It's the brain doing its job. Just like, right, this would be the idea of, the brain's, for lack of a better term, heartbeat, right? The fact that these neurons are firing is what's causing us to do stuff. Now, we do know that certain areas of the brain perform specific functions, so there is something to say about this idea of materialism, right? That certain material parts of the brain do things. Okay, that's great. But now I want to ask, how do we understand the levels or this idea of consciousness? And so this maybe is something that is best described as a metaphor. So back in the day, Sigmund Freud proposed the idea that human beings are not just driven by our conscious mental thoughts, right? You can think, I'm hungry, so I'm going to go pick up some food. Certainly, that's a conscious thought. But he's going to argue that there are certain things going on in our brain that are non-conscious, that are outside of our awareness, but still are helping us with the world. You know how to walk and talk at the same time. You probably have, been able to do this for a long time. How is it that you are able to do these things at once? How is it that your brain's able to take all this information? And Freud argued this is a really great idea. This idea that what we're thinking about right now isn't the only thing that's affecting how, what we're doing. Freud, though, kind of took this a couple steps too far, where he argued that things like feeling aggressive back in like 1900 is going to be something that humans push down. And so Freud comes from this really interesting perspective of like, imagine that you had a really negative relationship with your parents growing up, and you have to go home during the summer to see them. Freud would argue that consciously, you might say, oh, I like my parents, but unconsciously, you're storing some of that memory that you, right, of dislike of that, and that might be affecting you. So again, on the whole, this makes a lot of sense, but Freud's perspective I wouldn't clarify as the best. So he uses this idea of an iceberg, and we like this iceberg model here to kind of describe levels of consciousness. And so just like an iceberg, certain parts of it are above the surface, and that we would consider our consciousness. So you paying attention to this video right now, supposedly you are, and not just goofing off, right? You are aware of what is going on. You might be taking notes. That is above the water here. However, we can go under the water, underneath the conscious level, right? So this is going to be levels underneath consciousness. So thoughts and events that we aren't necessarily aware of. Now, some of these things we can absolutely be aware of, right? In our pre-conscious. So imagine that you are on this iceberg and you just look a couple inches under the water and you see some fish swimming, right? This is something we can do. These are our thoughts that are hovering just below conscious awareness. So things that we can probably bring to our mind very quickly. So if you just got into a fight with mom and dad, and I asked you how you were doing, right, that's probably something that's either conscious on your mind or it's going to come to your mind quickly. Even things like what you had for breakfast or dinner, hopefully, are going to be pre-conscious. Further down here, right, beyond where we can see into the water is going to be our subconscious. Our subconscious are going to be anything that is below conscious, but might become conscious eventually. So I think about things like, and Freud would argue that this would be things like repressed memories. So again, if I really hated my parents, I don't, I might harbor that, but not really realize that I'm really mad at my parents. And so this might be something that comes to mind if I want it to. Additionally, like what I got for my 10th birthday might be something that is in my subconscious, but it takes a while for me to bring it up. It's not right at the high level of consciousness. And this might include things that we just aren't able to remember. And Freud would say that we repressed or pushed down those memories too far and we're not able to think about them. But I don't know about that. What about at the very bottom of the iceberg? Well, we would call this the non-conscious, not conscious. It is not going to be something we are aware of. These are not really thoughts, but these are mental signals that we're not going to become conscious of. For instance, your heart rate, right? This autonomic nervous system, parasympathetic and sympathetic nervous system is going to work automatically. When you get sleepy, that's not something you can really control. When your body says, all right, I'm going to digest this food, you can't sit there and really try to digest it. So recognizing this idea. So if this seems a little abstract, maybe this helps you. So take that model, but think about it with a computer. And so you can imagine this very much like we would a Windows operating system here, but this works if you got a Mac. So your consciousness is theoretically this YouTube video, which you have front and center on your window. I totally know that's the truth. However, you might have a different tab on your browser, or you might have a couple different applications open at the bottom. Those are going to be your pre-conscious. Those are things that you can really quickly switch to, and they're probably something that you need in the near future or just got done using. On the other hand, if you need to open Microsoft Word and pull out a document from last semester, that's in your subconscious, quote unquote. Whereas your non-conscious are all of those things like in your task manager that you probably shouldn't touch that might end up getting your computer right to turn off, right? If I accidentally delete the signal that sends out the that keeps the Wi-Fi signal on. Don't want to do that, just like I don't want to cut any signals that keep me breathing. Now, an interesting question we might ask is, what happens with individuals who maybe go into a coma or have some sort of issue where they are not conscious and they are not becoming conscious? Well, there's different levels. For instance, many people who have been in comas and have gone on to recover have reported hearing loved ones or nurses speaking to them. So having information still coming in. However, right, there are certain levels of brain death, right, where you can see there is no longer any level of consciousness. So, right, unfortunately, there's no good answer to the question of can a person in a coma or who is kind of unconscious for one of those type of reasons hear or understand or perceive what we're saying? And the answer is, at least in some cases, it seems to be. However, an individual such as this patient with total brain death, you can see none of the actual internal organs, the limbic system, the kind of forebrain and hindbrain, they are not actually working. So to give you an example question here, imagine that you are thinking, oh, I'm not feeling so good, and you're trying to remember what you ate to get so sick, and so you remember, oh, yesterday I had sushi, maybe that's it. Before bringing that thought to your conscious level, where was that? Was it in your non-conscious, unconscious, pre-conscious, or near conscious? The answer is preconscious, right? It is in the preconscious because it is right below the surface. So it's important to note that we can process things without being consciously aware of them. We're not always aware of what we're doing. This little GIF down here shows you what a Tesla sees. And mentally, we're doing all these calculations. How far away is that car in front of us? Is that a stop sign? This, that, and the other. But we're not always paying attention mentally, consciously to those things. So recognizing that, right, our eye movement, brain activity, nervous system all respond properly to these things, even if maybe we're not consciously aware of them. An example of this, not just in this, is an example of people who have issues perceiving faces, or prosopagnosia. So maybe you have heard of the book by Oliver Sacks, The Man Who Mistook His Wife for a Hat. This is a man who had prosopagnosia. He was unable to recognize faces. Now, he could recognize objects and people by voice, but he wasn't able to recognize what those faces were. It would be the same as if I asked you the differences between all of these puppies, right? They're all very similar to us. Fascinatingly enough, your brain does seem to know this non-consciously. If I had prosopagnosia and my wife were to, show up at my work, my body would go, "Hey, that's her. I'm excited to see her." But consciously, I would say, "Oh, there's a person." I wouldn't know that. There's a fun little game you can look or you can play if you would like to on the slides. But additionally, there's a video with the PowerPoints that goes over this. Moving on from here, though, let's talk about the other states of consciousness. So for the most part, we all experience consciousness normally. But again, if you've ever been sick, you've ever been really tired or woken up and feel like it's not even the same year, that is going to be an altered state of consciousness. So we talk about sleep as a major one. We talk about things like hypnosis and meditation as another way of changing consciousness. And additionally, psychoactive drugs. Now, how these affect us is different, right? Like we said, qualia is a subjective thing. So how our subjective feelings are affected by these altered states is subjective. It changes the way we think. It tends to disturb a sense of time. People tend to feel a loss of sense of control. It might change emotional expression. It might alter how a person feels about their body or how they feel about themselves in the world. And additionally, we can talk about perceptual or disturbances in kind of what they perceive and see in the world, going back to how LSD can mimic synesthesia. Now, it's important to note that all of these can affect our consciousness, but maybe some more than others. For instance, alterations in body image and sense of self is not something that sleeping really affects. However, I don't know what happens between when I fall asleep and when I wake up. It's just an instant for me. But let's talk about sleep specifically before we get into hypnosis and meditation and then drugs. Question I always ask people is, do you get enough sleep? And as a college student, your answer is almost certainly no, you do not. You can notice here that for very, very young children, up until about 2, these kids need a lot of sleep. They need approximately 16 hours of sleep, a baby does when they are born, and kids up until about 2 are still going to need over 12 hours of sleep. That's why young children take naps. Now, you'll notice that we are actually breaking sleep into 2 different types here. We're talking about non-REM sleep and REM sleep. So REM sleep, this rapid eye movement, is going to be very affected in dreaming. And then non-REM sleep is going to be kind of all of the rest of this. So you might ask, why do children need so much REM sleep? Well, one hypothesis is that kids are learning a lot in these first couple years of life. So this is helping them to learn. A major hypothesis with dreaming, as we'll mention, is it's useful to learn. But you'll notice that as the lifespan goes on, you need less sleep. You still need sleep, of course, but there is a less need for sleep as time goes on. And once we have hit adulthood, our need for extra dream level of sleep goes down. Again, possibly suggesting that we really need a lot of sleep as kids to learn. Why might it be important to learn, right, to sleep when you're in college as well? Because it helps you learn. Now, I show an example of a night of sleep here, as well as an example of my sleep tracking. Thanks for having an infant. This will do this to you. But you can see what happens with sleep is it's almost like a reverse roller coaster in terms of how we view this. We have wakefulness, rest, and then 3 levels of sleep. You can just think of this as kind of core sleep, which is described down here, versus deep sleep. I'm not really going to get into the differences between these sets. But what you'll notice is that when we are awake, we have a certain pattern of brain waves that are firing. However, when you are falling asleep, resting in your chair, closing your eyes during a lecture, then your brain is going to go into this resting stage of sleep. This is maybe where if you've ever accidentally almost fallen asleep and jerked yourself awake, right, this hypnagogic jerk. Well, once we hit that, all of a sudden, right after we've fallen asleep, we immediately fall into a very deep level of sleep, the deepest level, the hardest to become awake. You want to think about this as the kind of deepest, furthest from awakeness we can get. And for about an hour and a half, about 90 minutes, we rest in this very, very deep state before we go into our REM sleep, our rapid eye movement. You can see that over here. My kid woke me up a couple times, but most of my early sleep is in core and deep sleep, right? These lower levels. But later on in the night, I spend more time in REM sleep. So you'll notice that REM sleep kind of comes and goes and comes and goes. Why might this happen? Well, you can't protect yourself when you're asleep. You're not conscious. So our bodies need to prioritize certain bodily functions when we are asleep. And so some of those functions are going to be repair the body and the brain. Those we are going to focus on, right, putting our body in a very deep sleep so that our body can repair. But only for a little bit. We don't want to be stuck for hours and hours and hours in case a tiger walks by and tries to eat us. So eventually, we take a short break from that and fall into REM sleep. Now, in rapid eye movement, your body is, again, locking your entire self muscularly, except for your eyes. Rapid eye movement. And your eyes are going to look back and forth very rapidly. Why? Because this is a stage where your brain waves look almost like you're awake. It's almost like you are looking around, right? But your body is not moving here. So what this allows us to do is kind of check, here, are there any things coming to get us? If we don't hear those, maybe we can spend a little bit more time resting our body before we then kind of switch off into working with resting our brain until the end of the evening, or I guess the end of the night into the morning. So again, recognizing that our sleep pattern is going to differ throughout the night as well as across the lifespan. And it's important to note that we need rapid eye movement level sleep, because what happens if we don't? Well, we gain a sleep debt. And this sleep debt is something you can't necessarily pay off. It's the idea that if you spend all night staying up studying for an exam, the next day you have made a debt in how much rapid eye movement level sleep you should get. You have less than normal. You have to pay that debt. You are going to pay that debt the next day by putting your brain into more rapid eye movement sleep. Okay, but if there's more rapid eye movement sleep, you have less room in that time frame to rest your body. Additionally, as we mentioned with the memory chapter, staying up all night is not going to be helpful for memorization if you're trying to do that. Now, another question for you here. You could imagine that Tasha, like many college students, is suffering from a lack of sleep. So in calculus today, she's rolling her eyes and her arm twitched. Which of the following best describes her level, her experience here? You would argue that this is going to be stage 1 sleep or rest level sleep. I'm not going to get too specific on this, but right, this idea that you are still in the rest level here. But that begs the question, why do we sleep? Well, we sleep because we have a circadian rhythm. Our body tells us to sleep. Our sleep is really useful. It helps restore the brain and the body. It helps rebuild the brain's nerve connections. It helps to restore that neurotransmitter sensitivity. And it seems to help us consolidate in our brain what happened today, remembering things. So how does that work? Well, dreaming. Now, some of us may have experienced lucid dreaming, an awareness that you're in a dream while it's awake, or excuse me, you're kind of aware that this is a dream while you are still in that dream. However, many of us don't have that level of consciousness. Now, what's the purpose of dreaming? Well, there's a couple theories. From a Freudian perspective, back in the day, we believed that dreams were a way that we could kind of imagine what we wanted, a wish fulfillment. And so you can imagine that in a dream, right, you would go see a psychologist and you would tell them about your dreams. What happened in my dream? There was a bear that I had to fight to protect my dog or something like that. That's going to be the manifest content, what my dreams manifest as. However, Freud argued that there was a latent or underlying meaning to that maybe the bear represented the fear of my father, and that the fact that I needed to fight this was because I am, scared of how my dad will react to me, or like something on this level. This is ignored by modern day, equivalencies, but there's nothing to really say that just because I saw a bear in my dream, it represents my parent or something of this sort. Another theory, we can argue, the activation synthesis theory, comes down to the idea that, well, maybe it's just like what happens when you mash a keyboard together. Sometimes there will be words that make sense. Maybe if we just randomly fire our neurons off while they're being quote unquote cleaned out throughout the evening, maybe that's going to help us to interpret a dream. Maybe that's the reason all of a sudden the neurons fire that say I'm in Walmart and that I'm on a pirate ship, that both of those fire together. Hence, I'm on a pirate ship in Walmart in my dream. So this theory argues that there's no real our dreams don't mean anything of importance. What there is evidence for, though, is the cognitive theory of dreaming. Why would we dream? Well, because it's something we can do. Dreaming is just a process. It's a way that we can think in a way from similar life. Maybe the fact that dreams can be used as a way to imagine what could go different or what has happened. Now, why do we dream the things we do? Dreams do tend to reflect our daily concerns about our everyday life, because we're going to integrate what we've learned during the day into our memory. Now, it does aid in memory, in that it turns out that if you are dreaming about doing something, you tend to do better on it. If you are learning skiing or snowboarding and you go home for the day, if you are to it seems to be the case where people are more likely to dream about whatever sport they're playing, in this example, skiing or snowboarding, and then that could theoretically help them do better the next day. That's why many people say, I'm going to take a break and come back to it tomorrow. There's a great video by Vsauce about why we dream, but again, I'm not looking to get copyright claimed here. But let's talk about some disorders with sleeping. The fact is that not all of us can get a good night's sleep. One thing that happens to many people is this idea of insomnia. If you can't fall asleep, or if you have trouble staying asleep for more than 2 weeks, this is a disorder. This is going to cause, impaired functioning, mental distress. It also raises symptoms of depression and anxiety. Another disorder, kind of on the other hand, the opposite of this, is narcolepsy. If you've ever seen the movie Rat Race here, narcolepsy is the brain's kind of automatic drop into REM sleep from being awake rather than going through that whole roller coaster. And so the idea is that your body is going to collapse, it's going to lock up, but your eyes are still going to move. And so you're going to fall asleep. Now, typically, I think they would fall, not like this example here, but what have you. Another disorder is sleep apnea. Sleep apnea is the issue with air getting into the lungs, more or less. I'm not a doctor here I'm not a medical doctor, I should say. On the other hand, we have sudden infant death syndrome, SIDS. SIDS is unexplainable, right? Sudden infant. Right, this is the idea that infants just suddenly stop breathing and die. So some reason might be from suffocation due to sleeping face down. It's why we have babies sleep face up. But more recent research has showed there might be a genetic component suggesting that, right, there's just kind of some chance there. From that, we can talk about sleepwalking. So sleepwalking is just walking during non-REM sleep versus REM behavior disorder is going to be moving around during REM sleep, during rapid eye movement. So sleepwalking tends to be more common in children. They're probably dreaming a little bit more. And they, right, is probably kind of overlapping with this moving from moving to less dreaming, as well as this REM behavior disorder where you can imagine a person is acting out their dreams. So, possibly at the most severe, trying to drive their car or something of this sort. We can also talk about nightmares. Nightmares are just frightening dreams that we have. We've all had nightmares. They're not great, but that is different than a night terror. A night terror is going to be when you are in your deep core levels of sleep and all of a sudden you are waking up not dreaming, but just with an emotion. And it's usually fear. So you can imagine that your body just wakes up and says, you need to be extremely afraid right now. And so, right, your body is just waking up and saying, be afraid. This is right, why are you terrified? No, necessarily, there's no good reason here. But, all right, this is one thing that does happen to people. Now, if you're going to imagine a question you might see on an exam, right? If your roommate says that, hey, you wake up 20, 30 times in the night, but, you go right back to sleep. You are probably experiencing sleep apnea here. But if your roommate, now you hear him in his room, wakes up to a blood-curdling scream of panic in the middle of the night, you walk over and you say, hey, buddy, what happened? And he's just scared and he doesn't remember anything that happened. What is he suffering from? Well, the best answer here would be night terrors. So sleep is an important thing, but we can also talk about hypnosis and dreaming. Hypnosis is real. It's an altered state of consciousness that's brought on in many different ways. It can change people's behavior. Now, some people are more hypnotically susceptible than others. About 10% of people can't be hypnotized, and it seems that brain structures do change when you are hypnotized, so suggesting this is an altered state. But it turns out that people who are more likely to be hypnotized tend to have more active imaginations. They tend to be able to fantasize, and they tend to be able to focus for long periods of time. Not only that, they tend to process info very quickly, and so they're kind of just going with the flow. They're not sitting there trying to figure out what's going on. Now, hypnosis has some uses here. There's research that shows that using hypnosis can lower pain, feelings of pain. People argue that being hypnotized can remove bad habits like smoking. Memory, maybe. Theoretically, people ask questions about this. Can this actually pull memory? We can talk about therapy in the sense of actually asking people, can you recall your childhood? But when we ask, or when we have hypnotized people, we can actually, with research, show that individuals who have chemotherapy and have been hypnotized have less nausea from doing chemo. There's less surgical bleeding from some participants who get hypnotized before surgery. And being hypnotized can actually increase your postoperative or better your postoperative recovery times, get you out of the hospital faster. So, whether or not it's a placebo effect, it does seem to be the case where altered consciousness as hypnosis does matter. Additionally, we can talk about meditation. So, meditation can be a lot of different things, but it's the idea of focusing on your thoughts, focusing on what you are kind of consciously experiencing now, not necessarily your memories or what you want to do in the future. People who meditate frequently and people who are in a state of meditation show different brain patterns that are unique from people asleep and people who are awake. And people who meditate also tend to be more likely to handle negative situations in their lives. A couple types of meditation you can use, right, are this idea of mindfulness meditation. So just being mindful of your thoughts, not necessarily judging them, just letting them pass by you. And then this idea of loving kindness meditation, treating oneself with kindness, self-compassion, and gratitude. And you would be surprised at how little people tend to do that. But the idea of simply thinking about how you're an okay person and you're a decent human being and you have things to be grateful for, that is a really helpful thing. Now, our final topic we're going to cover is drugs. And well, what is a drug is a question we can ask. And what we can say is that what we decide drugs are is different depending on where in the world you are, what we're doing. But when we talk about this, we want to describe this as psychoactive drugs. As psychologists, we're interested in the psychological effects of this. Now, drugs, regardless of what type, whether that be something like aspirin or something like cannabis, alcohol, these all are going to have possible dependency issues. Some of those are physical. You can imagine a person who can't go without coffee without having a headache, has a physical dependence on a drug. You can also imagine a psychological dependence. We know that cannabis is not physically dependent. It doesn't make people physically dependent. However, people will become psychologically dependent on it, believe they need it. And we're going to talk about 3 different classes of drugs here, depressants, stimulants, and hallucinogens. And we're actually also going to mention the idea of opiates. But we're going to talk about how these different sets of drugs affect not only our consciousness, but also our nervous system. So the first type of drug we talk about are depressants, things like alcohol or different tranquilizers or some narcotics. Also, some strains of cannabis can be depressants. They depress or lower the nervous system, right? So any sedatives you have, barbiturates, sleeping pills, those are going to depress your nervous system, lower it. This is going to make things less likely to fire. Hence why if you drink alcohol, a lot of alcohol, you are going to have trouble with balancing. Your signals in your cerebellum are not going to fire as well. Compare depressants to the opposite, stimulants. Stimulants increase nervous system activity. Things like amphetamines, nicotine, coffee, right, caffeine, cocaine, some cannabis as well, can alter your state of consciousness and increase the nervous system activity. So many of us have tried the drug coffee or caffeine at least. And so we might notice that makes us jittery, it makes us wiry, it makes our central nervous system increase responses, right? So it's going to increase norepinephrine and dopamine to the body. Beyond that, we can talk about hallucinogens, how hallucinogens are going to only modify a person's perceptual experiences, or I should say that's going to be the majority of effect here. So this could be psilocybin, which are magic mushrooms, some types of cannabis, ketamine as well, and things like LSD. These are going to mostly change how we perceive ourselves or the world for some period of time. Additionally, we have the last class here, opiates. Opiates from the poppy plant here have a lot of complex effects on consciousness. Some, all right, all opiates induce euphoria. They might kind of increase sleep, the need for feeling of sleep. They might kind of decrease the feeling of pain. And all of these examples from opium poppy, right? Opium, codeine, morphine, heroin, and there's some research to say cannabis. I promise I'm not trying to promote it. I'm just saying that that is what I've got from my book and from my info I have. But recognizing that all of these are going to play a unique role on how we now experience the world until these effects wear off. Another question for you, you could imagine if Gina got drunk last night, which made her feel disinhibited and relaxed. She was drinking alcohol. She is using a depressant here. And to summarize, just a kind of last minute thing, please don't abuse opiates, right? Opiates are something that people often really like, and they, not only that, right, they induce pleasure. However, overdoses are extremely common and they are extremely addictive. I always show this photo from 2016 of these two individuals, two parents with their 4-year-old in the back seat. This happened 25 miles from my childhood home. Addiction is a real thing. And so recognizing that having this, change in your nervous system might make you want it more. However, right, that's kind of just me getting on my soapbox. But that's the end of this video. I hope you all found it at least somewhat useful. Let me know if you have any questions, and I hope you all have a great day. Bye-bye.